Good day, I am Julianne Calipas, BSN1J, and in this video, I am going to talk about HIV awareness. HIV or human immunodeficiency virus is a virus that attacks the body's immune system. If HIV is not treated, it can lead to AIDS or acquired immunodeficiency syndrome. There is currently no effective cure. Once people get HIV, they have it for life. But with proper medical care, HIV can be controlled. People with HIV who get effective HIV treatment can live long, healthy lives and protect their partners.
And also, AIDS or acquired immunodeficiency syndrome is a chronic, potential life-threatening condition caused by the human immunodeficiency virus or HIV. By damaging your immune system, HIV interferes with your body's ability to fight infection and disease. This act isn't strengthening the Philippine Comprehensive Policy on HIV and AIDS prevention, treatment, care, and support, and also reconstituting the Philippine AIDS Council, repealing for the purpose RA 8504, otherwise known as the Philippine AIDS Prevention and Control Act of 1998. HIV can be transmitted through sexual relationship without protection. HIV is spread most commonly by sexual contact with an infected partner. The second one is sharing needles. HIV is frequently spread by sharing needles, syringe, or drug use equipment with someone who is infected with the virus. The third one is blood transfusion or blood contamination. HIV may also be spread through contact with infected blood. However, due to the screening of blood for evidence of HIV infection, the risk of acquiring HIV from blood transfusion is extremely low. And the last one is mother-infant or pregnancy. HIV also can be spread to babies born to or breastfed by mothers infected with the virus. HIV does not survive long outside a human body, such as on surfaces, and it cannot reproduce outside a human host. It is not transmitted by mosquitoes, ticks, or other insects, through saliva, tears, or sweat, by hugging, shaking hands, sharing toilets, sharing dishes, or closed mouth or social kissing with someone who has HIV, through other sexual activities that don't involve the exchange of body fluids, for example, touching, and lastly is through the air. There are several symptoms of HIV. Not everyone will have the same symptoms. It depends on the person and what stage of the disease they are in. There are 3 stages of HIV and some of the symptoms people may experience. Stage 1 acute HIV infection. Within 2 to 4 weeks after infection with HIV, about 2/3 of people will have a flu-like illness. This is the body's natural response to HIV infection. Flu-like symptoms can include fever, chills, rash, night sweats, muscle ache, sore throat, fatigue, swollen lymph nodes, and mouth ulcers. These symptoms can last anywhere from a few days to several weeks, but some people do not have any symptoms at all during this early stage of HIV. Stage 2 clinical latency. In this stage, the virus still multiplies, but at very low levels. People in this stage may not feel sick or have any symptoms. It is also called chronic HIV infection. Without HIV treatment, people can stay in this stage for 10 or 15 years, but some move through this stage faster. Stage 3 AIDS. If you have HIV and you are not on HIV treatment, eventually the virus will weaken your body's immune system and you will progress to AIDS. This is the late stage of HIV infection. These are the symptoms of AIDS. Each of these symptoms can also be related to other illnesses. Here are the social factors that affect HIV cases. Prevention of HIV. Number 1 is by using condoms. Male latex condoms are the most effective way to prevent HIV and the other STIs when you have sex. Number 2 is get tested. Be sure you and your partner are tested for HIV and other STIs. Number 3 is be monogamous. Having sex with just one partner can lower your risk for HIV and other STIs. Number 4 is limit your number of sexual partners. 5. Get vaccinated. You can get a vaccine to protect against hepatitis B, which are STIs. There is no vaccine to prevent HIV. Lastly, do not abuse alcohol or drugs. Alcohol or drug abuse may lead to risky behaviors such as sharing needles to inject drugs or not using a condom when you have sex.